If you have questions, and I think you have been dropping them in the Q&A or the chat function, please feel free to put those in there and we will answer your questions now.
So I just want to say one thing about the advising through med school coach. The writing advisors are so vital,
Oh my God.
And I tell my students right off the bat, I am a terrible writer. And I know what needs to be in there. I know what like the ingredients that need to go into it, but I just can't make it sound good. And then, the person that founded this company, Dr. Sahil Mehta, brilliant guy, really in creating this triad of the student, physician advisor, writing advisor. And the writing advisors tend to be either PhDs in English or lawyers, just really masters of word choice and structure and ideas and so forth, transitions and themes. That process of that triad, I have never seen a bad outcome from that. And it's so cool to watch that blossoming of the written materials.
All right.
Good.
Well, awesome. Thank you so much, Dr. Nelson and Dr. Choo, for the presentation. And now we have about 20 minutes or so for the Q&A portion. And thank you to everyone who's been writing in the Q&A this whole time. We're going to get to as many questions as we can live, and the ones that we don't answer live, you're going to get emailed answers and responses as well later on. So thank you, and keep on asking those. This was an awesome presentation that really did kind of go over the broad scope of things to think about when applying to medical school. But of course, there's a lot of nuance there, and that's the benefit of what it sounds like with you working one-on-one with advisors who can really understand your personal journey the best and help prepare an application for medical school. But now, and remember, for everyone watching live, this is recorded. This will be sent to your email on Monday. You don't have to watch all of the sessions live, and you can take breaks, you can go to the bathroom, you can get food. This is all being recorded and will be sent to you. But to get into the first question, I saw a lot of questions in the chat from students like Nancy who were saying, maybe she hasn't taken the MCAT yet and needs to take the MCAT and needs to schedule it. Well, what's the best real timing to do that? And can you submit an application before the MCAT is done, or if you're waiting for a score? Dr. Nelson, what are your thoughts about kind of timing the MCAT to make sure you're as prepared as possible, but also you don't want to send it too late?
Sure. Well, thank you, Dr. Katz, for being the host of this and moderating. It's just a pleasure to work with you. Nancy, thank you for that question. Love to hear Dr. Choo's perspective on this as well. But what I tell my students right off the bat, if they're kind of not sure on their timeline, this is a marathon, not a sprint. And if you're trying to kind of stuff things in and you're cutting your timeline shorter and shorter, you're gonna stumble and fall and not make it across the finish line. So if you're looking at this application cycle of 25-26, where the primary applications are going to be submitted in about 6 weeks, there is not enough time in there to begin preparing for the MCAT, take it, and still apply on time. Because there's good data out there that shows it takes a solid 3 to 6 months of designated MCAT prep in order to kind of maximize your score probability. So I would really, if you're at the beginning of your MCAT prep or just kind of preparing to start on it, then I would be looking at the 26-27 cycle and give yourself that ample time to prepare for it. And also give yourself some time to plug any other kind of gaps in your competencies.
I would say that if you have started studying already, then I would not take it later than May. Because if you get it in May, let's say end of May, you take your MCAT, you can still submit your application with one school on your list that you're sure you're going to apply to no matter what. And once your MCAT score is back about a month later, then you can finalize that school list, get it in before schools start receiving applications at the end of June. So that's why I recommend not going any later than May if you're going to be taking it this cycle and applying.
Yeah, absolutely. And I see a bunch of questions about shadowing. And just to help out, we created a shadowing series that's completely free. If you haven't yet checked it out, it's literally just shadowing.medschoolcoach.com. There's 25 hours of shadowing. It's right there in the chat. which you can do on your own time and get certificates for it, which all count towards your medical school application. And then another question that I saw in the chat was, this one's for Dr. Choo. It's about the number of hours for different extracurriculars and requirements. Carlos asked about the amount of hours that you really kind of tend to look for. Is there a minimum, whether it's shadowing or extracurriculars, or is it really more about what you make of the experience?
There are hours, and sometimes I hesitate to say them all just because they're nice minimums, but they're not everything, right? So, for example, with shadowing, I usually say minimum 50 to 100 hours, minimum 2 to 3 different shadowing specialties that you do. So 50 to 100 hours total. It's not that you have to do 100 hours for both. And if you have a little more than that, that's fine. I personally don't think you have to do much more than that because shadowing is somewhat of a limited experience. For something like clinical, I think that's one of the most important categories. And we generally say minimum 200 hours or so. But we're also looking at more than that. So if you did 200 hours working for a short amount of time over one summer, that doesn't look quite as good as getting that 200 hours over a longer period of time where you had to consistently go and participate in this activity. And I think 200 hours generally is quite low. So if you look at it, you're also competing with people that have graduated from college and are working full-time and have been working full-time, right? They have thousands of hours. So I think that a nicer minimum is probably in the 500 plus range if you can do it. That doesn't mean, a lot of times talking to me and Dr. Nelson can feel like you're trying to take sips from a fire hose, right? It's a lot of information and a lot of stuff you have to do. And I always tell people, I'm just telling you what would be ideal. That doesn't mean you have to do every single thing. The schools are going to do a holistic review of your application. So once you hear all these things, it's up to you to kind of figure out what is actually reasonable and that I'm able to and capable of doing in this amount of time. So same with volunteering that's not clinical. I generally recommend a minimum of 200 hours and a year. Generally 200 and a year of service is kind of what I say as kind of a minimum number.
Understood. Awesome. Thank you for that answer. And then in just the interest of getting to as many questions as possible for Dr. Nelson, Deanna asked a little bit about kind of what specific requirements schools have. Like, do different medical schools have different requirements, or is there kind of a blanket requirement across the board? Have you noticed that certain medical schools might have particular ways that an applicant should tailor their application or additional things that they're looking for?
Good question. So, the short answer is no. They're pretty similar in what they're looking for as far as those general competencies that will make you succeed in being a doctor. There are some niches. I would say some of the more upper echelon schools like your Johns Hopkins, Harvard, Mayo. They want to see a lot more research on your application. But for the majority of other schools, they're looking kind of for all the same things. Now, if you're talking a prerequisite for a coursework, there are some nuanced differences in the prerequisites from school to school, but most schools require what we call the core prerequisites, which is a year of these courses with labs, biology, general chemistry, organic chemistry, physics, and then statistics, psychology, English composition, and math. So if you have those core prerequisites, the differences beyond that from school to school, you can take those courses before you start that school. For example, like University of Arizona Phoenix is one of the few medical schools in the U.S. that requires physiology, which is a very rare prerequisite. But you don't need physiology to apply to that school, but you can, if you get accepted, you can take physiology before you start. And that tends to be the differences between the schools.
Gotcha. Okay, that makes sense. Dr. Chu, question for you from Bryce about being a non-traditional applicant. How does somebody who's, having a full-time job or has been outside of kind of just college or education for several years get back into it? How do you, advise students who are coming from a non-traditional background but want to switch careers and become physicians?
Yeah. Thank you for the question, Bryce. We do advise a lot of people that are non-traditional applicants, and a lot of it is basically showing the medical school why you're making the switch, showing that you've investigated why this switch is the right switch for you, and having kind of showing that strong why for a non-traditional applicant. So it is important to get some kind of clinical / research / volunteer experience before you apply. So if you only had those experiences during college and now it's 7 years later and you haven't done anything clinical or research or volunteer since then that doesn't look as good as you've been working and you've been volunteering on the weekends at some free clinic or something like that, so that they can see that you have started to investigate the pre-medical path and you've done some recent work in those areas and you found that this is XYZ reasons why you want to make that switch. So it requires some thought and planning and making sure you're like doing stuff that is vital for furthering your application chances. So non-traditional people, I think, need to be very intentional with what they choose to do with their time and everything, but it's certainly possible. And I think medical schools really love people like that because you have more life experience, more work experience, things like that, and bring a lot to the table that way.
Yeah, absolutely. And in the next session, in just about 10 minutes, we're going to hear directly from 3 deans, current deans of medical schools, and we'll be able to ask them Q&A questions as well. But for the next 10 minutes, Dr. Nelson, a quick question for you is expanding upon this idea of non-traditional applications. What have you seen in terms of trends with students taking gap years, and what are certain ways that people can, use those gap years to strengthen an application?
Absolutely. Thank you. The trend in gap years has gone kind of the opposite from where it was when I applied to medical school in 1991, which, yeah, that was a long time ago. Most people did not do a gap year. I think that the numbers on that are around 10% of students did gap years at that point. Now it's flipped. Now 80% of students are taking a gap year, and the admissions committees really want to see those gap years, at least one, if not two. Because there's so much good life experience, life maturation that happens in that really sets that student up for better success. And so the admissions committees are looking for that. If you're wondering what to do during that gap year, there's a myriad of things you can do. If your undergraduate coursework grades are lower than average as far as your GPA, getting a master's of science in medical science is a great use of your time. It mirrors the first year of medical school curriculum. It's your ability to prove that you can do well in that environment. Go work as an EMT or a phlebotomist. Get that really solid clinical experience. But don't just do that. You can get a job as an EMT or a phlebotomist and then do some non-clinical volunteering as well. But just being efficient about gaining as many of those competencies that you can to then translate onto your application.
Absolutely. Dr. Choo, a question for you from Maria, who says she's pursuing research and service together, but some schools might emphasize more of a research mission versus other schools might, emphasize more of a service commitment. Do you recommend students tailor the medical school list that they make and apply to different medical schools based on what their strengths are in the application?
Yes, so Maria, I think that it depends, it kind of depends on that person's goals. I think it's important to be looking at what schools might be a good fit for you. So if a school is really heavily research and you didn't really like research and you kind of did it to just check it off the box, then probably those big research schools, you just wouldn't be as happy there because they're going to really emphasize that research in their curriculum. Similarly, some of the schools that don't really emphasize research as much, maybe you really want to make sure that you have a heart for your community. And if you don't have that community service hours in, then they may not be as happy to have you there. So looking at the school's mission, looking at what their students tend to go into, looking at kind of what your own passions are, I think you should tailor the school list to what, if you have hard leanings one way or another, that you should try to choose mostly schools that kind of lean the same way that you do.
That's very, very helpful. Thanks. Jen asks a question for you, Dr. Nelson, which is actually something Dr. Chang talked about in his keynote speech today about kind of having interests and hobbies that maybe not necessarily 100% relate to clinical medicine. How do you, weave in hobbies into an application, and how do you express that side of yourself that isn't maybe just 100% related to practicing medicine, but you're still a big part of who you are?
Great question. So there's, it's no secret that there's a huge problem with burnout in medicine. And with the hobbies part of your application, show how that hobby balances your work life. Show how that really centers you from all these other things that you have going on, and they can be weaved in beautifully. I had a student that wrote about collecting sports cards, like baseball cards, and he wrote about it as a hobby on his application. And at first, I'm like, oh boy, that's that's not gonna work. It was amazing because it turned out it was like a family thing, and it was a competition amongst the family, and it was a designated time every week that they got together, and just uh, the growth that came out of that, just that hobby was phenomenal.
Gotcha. Yeah, there's always a way to weave in the growth that you can get from the interest that you do. It's not all about just having an application that's completely dedicated to practicing medicine. There's a lot more that makes us who we are than that. But one of the ways to get a clinical experience, like you mentioned, is being an EMT or being a phlebotomist. What are some other interesting types of clinical experience, Dr. Chu, that you've seen students who you've worked with have? Like, what are some of their backgrounds? What are some ways to get involved in patient care and to really make sure this career is right for somebody?
Yeah, so the most common ones that we see are hospital volunteering, free clinic volunteering. I would say MA and EMT are probably the most common. Scribing is common as well. I have lost my enthusiasm for scribing as an activity, in that if it's your only clinical experience, I have found that people tend to have a hard time coming up with interesting things to talk about that show off the competencies in their application, because everything they've done is observational. They never really interact with the patient. So if it's the only thing you can get, it's better than not having clinical experience. But I tend to push people to not necessarily do all of their experience describing, because then they don't have as much to show their own strengths as much. I've seen people be EKG technicians, transport people in the hospital, radiology technicians, even some people that were like pharmacy technicians who, even though it's not being a doctor, they, still had to interact a lot with people. Um, so phlebotomy is another one. Sometimes I think jobs are a little harder to get, at least in my area, for phlebotomy, but you definitely have to calm down a lot of nervous patients and have some technical skill to be a phlebotomist. So there's a lot of different things you can do. A lot of the ones that are really heavily clinical and that show the best are ones that you do need to get some kind of certification for. And so if you're taking a gap year, I think it is worth it to get that certification and get that job where you are really working heavily with patients. But there's a lot of things out there. You kind of have to see what's available in your area and what interests you. Hospice is another one too, as long as you're working directly with the patient. Some people do CNA, patient care technicians, those kinds of things as well are very heavily patient centered.
That was incredibly helpful. That's a whole list that I'm sure somebody can find something within that resonates and can work as a possible option for clinical experience. And in the last minute or so that we have, I want to ask each of you, starting with Dr. Nelson, just overall, the single biggest piece of advice you have. And I know that kind of feels like it might be a loaded question, but just, for the 900 students who are watching live and everybody else who's going to watch afterwards, what is the single biggest piece of advice you have for somebody interested in becoming a doctor? Dr. Nelson.
It's a marathon, and slow down, kind of enjoy that undergraduate experience and maybe gap year experience, and be intentional about the things that you invest your time into.
Yeah, I think that's great advice. And I would also say, know yourself. I think a lot of people are so focused on checking off the boxes, but you got to get to know yourself and what you love, or what you're passionate about, and what you want to continue pursuing in the future. So learning those things and getting involved in the stuff that you really love, I think is part of what really showcases who you are and can be the tipping point for getting in successfully.